Hello, everyone. I'm Cedric Peterson, and welcome to this special edition of Inside Government. My guest in this edition is the representative of the Emergency Support Function Group Number 6, represented here by the Department of CPS, that's the Department of Collective Prevention Services, and our very own epidemiologist on St. Martin, Mrs. Ava Lista DeWeaver. And we have the Inspector General of the Ministry of Public Health, Social Development, and Labor, Dr. Bess. It's great to have both of you inside government.
Thank you so much for having us.
Schedule's been very busy, so I know taking this time to come in and talk to us, it's first of all greatly appreciated, and we really want to get an update in regard to where we stand with this now, what is a pandemic on our planet. I want to start with the most basic question, as I always do, and we'll take it back to the beginning, so those who still are not aware, what is the coronavirus? Dr. Best?
A coronavirus is a virus. It's just a protein particle that's able to replicate in the human body, and it's part of the family of coronaviruses that causes also the common flu, seasonal flu.
Okay. And now we've got to the point where it's been titled COVID-19. Explain.
COVID-19 is actually the disease which is caused by the SARS-2 virus, which is the official name of the virus. You know, remember some years ago we had the first SARS outbreak. Now this is the second kind of similar symptoms outbreak, and that's why it's called the SARS-2 virus. And the disease, the whole complex of symptoms that it causes, is called COVID-19. That's the official name that the disease was given by WHO.
Okay. What are the symptoms that one can expect if they do contract COVID-19? Ava?
So right now, signs and symptoms that we are looking for include fever, so a fever of above 38 degrees Celsius, and or cough. So it could be a dry, unproductive cough or non-productive cough.
Okay.
And also shortness of breath. So we are asking people, especially if they've traveled recently, to keep in mind with those signs and symptoms. Of course, there are other symptoms that may not be as prominent, but those are sort of the three key symptoms that we're looking at right now.
Okay. So respiratory disease.
Yes.
All right. There's much information that we have to compete with as an organization that is now in emergency mode dealing with this issue.
Mm-hmm.
And we want to get as clear as possible as to what people should be aware of and what they should do. If one sees any of these signs, these symptoms, what should one do immediately?
So I would advise that the persons, whether it's yourself or your children, if you experience these signs and symptoms, especially having returned recently from a trip abroad, to stay at home. If you can, work from home, keep your children home, and dial your physician. Do not go to the hospital. Do not go to your doctor's office, because if you have these signs and symptoms, you may be potentially a suspected case. You may have this. So I would advise that you not leave. Stay at home, contact your physician, explain to them what signs and symptoms you're seeing, whether you've recently traveled, and then your physician will then refer you to, your physician will actually contact CPS.
CPS.
Yes.
Okay. And Dr. Best, the individuals, when they quarantine themselves, when people are trying to identify, well, how do I, self-quarantine? What comes to mind? What should be the first thing that a person should think about?
Well, self-quarantining means that you basically shut yourself, you distance yourself to start with from family within your own environment at home. That's where it starts. We're talking about self-quarantining at home. Okay, so that means you need a specific dedicated room for yourself, not sharing it with anybody at home. Okay, and that room has, of course, it needs to be properly ventilated. That's what you want. The person that is under quarantine should remain as much as possible in the room. Don't go wandering around in the house, intermixing with the others in the house. No. So remain in your room, make sure the room is ventilated. If you have a bathroom that is being shared at home, which might be often the case, that there's only one bathroom, only one restroom, you have to make sure that you clean it at least once a day with the proper disinfectant. Could be Clorox, whatever you want to use. The others, who are the healthy ones in the house, should make sure that it's one person, dedicated person also, who cares for the one that is sick. Don't let everybody in the house care for the person. You want to minimize the amount of contact. Okay. The next thing you need to consider that whatever the person is using, the sick person is using, utensils, plates, food, whatever, you need to separate that too from those that were used by the healthy persons. Washing clothes of the sick one, separate it, put it in a bin, wash them separately from the clothes from others. Those are a couple of things that you should bear in mind. The person who is sick, remain in the room. It's 2 weeks. Make sure you get internet, phone, whatever you need. It's going to be a hard time. But important thing is that everybody in the house knows what the rules are. And particularly the thing of sharing the bathroom and restroom, make sure that you clean that twice a day if possible.
All right, I think that segues into the question concerning what one needs to know when it comes to the transmission of this virus and how it is transmitted. Can you clarify that for me, please? Ava?
Sure. So the virus is transmitted by respiratory droplets. So what that means is when you are sick and you are coughing and sneezing or even talking in a close proximity to someone else, the particles, the particles could spread from me to you, for example.
Right, yeah.
And so that's why we've really tried to carry the message or convey the message of, proper respiratory etiquette. So if you are sick, if you are sneezing and coughing, to just cover your cough or sneeze with a tissue, because that's the primary way that it's transmitted from person to person.
Sure.
So another important thing that we've also tried to message is these respiratory particles, when you're talking, sneezing, coughing, drop on different surfaces and objects. And so that's why it's important that you are cognizant and aware of your surroundings, so that if I am coughing, in the studio, for example, my particles could potentially be all along the surface. And that's why it's really important to make sure that you constantly wipe high touch surface areas, because these particles, could last for several hours. I think there's still studies that are being looked into at how long it could last on surfaces. But with any infectious disease, it's important to make sure that high touch surfaces are cleaned frequently.
Right.
So in addition to, enhancing your cleaning, really paying attention to your respiratory etiquette. So coughing and sneezing as appropriate.
This virus being first starting in Wuhan, China. Now the WHO, as of their press briefing yesterday, indicated that the numbers worldwide outside of China has matched and exceeded. Can you give us an update? Thus the reason why I guess pandemic at this particular point. What's next based on that data?
Well, based on the data, what you're seeing now is that the next wave is started in Europe with Italy. And you see how rapid it's spreading through Europe now. The third wave actually is in the States. They're still lagging behind Europe there, although it's spread widely across the States. In the Caribbean and South America, that's the fourth area where it's now evolving. Just started to as well. But this thing, as you've seen with this virus, as you've seen with Italy and China, you can see how rapidly it spreads. So if you look at the measures that many of the countries have taken, and it varies a lot between countries. If you look, for example, at Holland, they're pretty soft compared to France and Spain. In France right now, they're penalizing you if you go out on the street.
Correct.
Without the proper authorization.
Correct.
Okay. So what China did was very draconic measures, but they succeeded, in bringing it back.
Right.
Try to remain below the curve or the area in the curve where your health services are completely overloaded. That's where basically everything will go sour.
Exactly. All right. So now our testing is what we are encouraged by the World Health Organization.
Well,
where are we in regard to that?
Testing is, if you look what the Netherlands is doing right now, they changed the case definitions a little bit for testing. So they say, whoever has symptoms now, we believe it. If you're not too sick, stay home, just quarantine yourself. We're not going to test you. That's a policy based on the capacity you have and the amount of tests. So if it's wise, we'll see. We still say we're going to test cases. The state is testing cases. The other downside of not testing is that the statistics you're going to produce
Exactly.
are non-comparable and might not be even reliable. But okay, we did that too in St. Martin in the past with Zika. At a certain point, we said, doctors, GPs, you see the patients, we don't send them in for tests anymore because it's so widespread.
Dengue.
Was it dengue?
Yeah,
I
dengue.
thought it was Zika.
Yeah.
Okay.
No, I think dengue.
Yeah.
Yeah.
Okay.
Yeah.
So the dengue fever or dengue that's transmitted by mosquitoes.
Mm-hmm.
Okay. So how serious at this point is this particular disease as it relates to St. Martin and our state of preparedness? What is it that we need to be cognizant of here at home? Next to the practices, of course, of washing one's hands, practicing good hygiene. Once we maintain this, what are you thinking overall future-wise? We'll be able to maintain control of this?
I think so. Right now, as I'd mentioned in previous press briefings, the important thing is quick identification of any suspected cases or confirmed case, making sure that we have proper contact tracing in play, making sure that we notify the appropriate contacts in a timely fashion. It's a matter of time before it's spread throughout the Caribbean, different countries. And I think making sure that your team is properly informed and equipped to actually conduct proper contact tracing, which we've already started. In this one case that happened today, I think that's important. I think another thing to stress is to the population not to panic. Of course, you're going to be heightened and you're going to be a bit more alert and aware of your surroundings. And I think that's sort of my key message, is to make sure that you are aware of your surroundings, be a bit more cognizant when you're in a social setting. I know that the Prime Minister has discussed really, if you can stay at home and avoid mass gatherings or what have you, then I think that should be the responsibility of, citizens need to be responsible. And that's, I think, one way to mitigate potential spread.
Of it, of course. And the education aspect, considering all of the information that's readily available, it's constantly reminded, especially since I sit here in a capacity as colleagues with you as ESF 8, to make sure that you go into the official sources of information.
Correct.
We encourage, of course, here locally at home, you can get an idea of what's taking place. Visit the government website, stmartingov.org. Listen to the government radio station 107.9 FM. If you're a Facebook user, go to facebook.com/SXMGOV and like that. I just saw Dr. Best going through his phone, and he's in tune as well and making sure that we stay up to date. So we appreciate that. What's next for both of you as ESF 6 as we continue to monitor this situation?
Well, the primary objective here in an outbreak is containment. It's containment. So what we want is, first of all, as Eva said, you should be on full alert. If you get symptoms or whatever and you're not sure, call your GP, don't go to the office, and let's find out what's wrong with you. Do you meet the criteria or not? So that will help us to contain the disease. That's for those who are on the island. Now, thank God we stopped those now from coming in, the others. But you might still get, because we don't know yet what is in the community. We get a case today. So you don't want to have community spreading. That's what you want to avoid, because once that is happening, we're really into problem. Okay, then containment becomes more difficult, because if you've seen it goes way out of hand, and you will have to resort back to very draconic measures.
Right. So it's the effort of the community to get involved and be informed as much as possible, so that you're taking the right actions.
And I was actually going to piggyback on Dr. Best. I think it's also very important for, residents, citizens of St. Martin to really adhere to self-quarantine or self-isolation and follow through with it, because as Dr. Best said, we need to try to contain whatever else is out there. So it takes a lot of discipline. I know it's not easy. I mean, after a couple of hours in one room, you want to move around, you want to go outside, you want to go for a drive. But when we say quarantine, it truly means you are not leaving your house. And so I would, take this opportunity to remind the public that it's all about discipline and, making sure that we're policing ourselves as neighbors, as friends, as colleagues. I think that's important to try to mitigate the spread.
And just to be clear, that quarantine period of time is suggested to now at 14?
14 days.
Okay.
Yes.
All right. Well, Dr. Best and Ava, thank you so much for coming in.
No, it's a pleasure.
And, of course, updating us on these matters. And we'll be, of course, bringing more information. And as new information comes in and is made available, we invite you to come back and join us for another edition as we keep tracking the developments related to this pandemic. So thank you once again.
Okay.
Thank
Thank
you.
you very much.
And to our radio listeners and television viewers, thank you for tuning in and being a part of this special edition of Inside Government. If you've missed a broadcast, be sure to tune in to the official government website, stmartingov.org. Also, be sure to subscribe to our YouTube channel. That's the youtube.com/St. Martin Government. And you'll be able to stay up to date with all programs produced by the Department of Communication, Emergency Support Function number 8. On behalf of all of us here at the Department of Communication, I'm Cedric Peterson. Thanks for tuning in.